Diabetes is the worst silent killer today. That diabetes is not just curable, it is reversible as well.
As diabetologists, we deal with only one gland, that's pancreas. Pre-diabetes is a condition where if you treat it, lifestyle modification is the key. There are drugs that you can stop, and that's the criteria of diabetes reversal, that your HbA1c has to be below 6.4 for 3 months. Teleconsultation for lifestyle disorder are actually better than physical visits.
Very thin people can also be diabetic.
If you are obese and you are diabetic, chances of your reversal is much more than a thin and lean person. Your bad habits like smoking, alcohol, tobacco make a huge part of a lifestyle disorder. Diabetes does not go anywhere. It is going to follow you.
Diabetes is the worst silent killer today. What if I were to tell you that diabetes is not just curable, it is reversible as well? So we have a guest with us today who is going to help us understand the different kinds of diabetes, how we can control it, and how it is not actually a disease, but simply a lifestyle disorder and can be easily reversed. So please welcome to VQ Podcasts, Dr. Nimmi Mulwani. Hello, Dr. Nimmi.
Thank you, Dr. Shachi.
Welcome to VQ Podcasts.
Thank you.
So, Dr. Nimmi, diabetes is something that almost everybody is scared of. And in my opinion, it is that silent killer because it affects a lot of organs that we don't even know are being affected. For example, I think the retina, the eyes, the kidney, and it does it at such a slow level that by the time you realize it's damaged, it's already too late.
I was an MBBS when I lost my grandfather to a leg amputation.
As a side effect of diabetes.
As a side effect of long-standing uncontrolled diabetes. And I have seen the suffrage that my family and my grandfather, who passed away sadly, went through. So that made me choose MD medicine. And after MD medicine, I have done 2 years fellowship course, which is strictly on diabetes and lifestyle disorder.
Okay.
So I practice as a diabetologist and a lifestyle physician. So I treat only diabetes. In my chamber, you have diabetes, you come and meet me.
So basically you are specifically for diabetes among all the other endocrinal disorders that an endocrinologist can.
Yes.
Okay.
So the difference between endocrinologists is they deal with all endocrine disease. As diabetologists, we deal with only one gland, that's pancreas. Diabetes is actually 3 different types.
Okay.
One is type 2 diabetes that happens to most of the adult population.
The most commonest one that all of us are scared of. Okay.
90% people around us who have diabetes have type 2 diabetes.
Okay.
That has some modifiable factors like our physical activity, our stress level, our burdens. Okay. This is what is depending on lifestyle. So it qualifies as a lifestyle disorder. Second is type 1 diabetes that happens to generally younger kids.
Juvenile diabetes.
Juvenile diabetes is now type 1 diabetes. It is always insulin dependent. So the only treatment available is type 1 diabetes. The only type of diabetes which cannot be reversed is type 1 diabetes.
And you have to give insulin in that.
There's no option. That's the only treatment.
The pancreas has stopped producing or doesn't produce by default.
That's the only treatment all around the globe. And third type of diabetes is gestational diabetes, which happens in the later stage of pregnancy. In the 3rd trimester. So type 2 diabetes and GDM are very much reversible.
They both are reversible.
They both are very much reversible.
So for our listeners, when do you classify your sugar levels to say that you are a diabetic? What does your fasting blood have to be? What does your postprandial have to be? What does your H1BC have to be to classify you as a diabetic or a borderline diabetic, one who requires, to have interventional help from you?
True. There are stages. Okay. One is diabetes mellitus. One is pre-diabetes. Pre-diabetes is a precursor to diabetes. So the criteria is very clear by American Diabetic Association, even our RSSTI association. Fasting below 100 is normal.
Okay. So
Empty
100
stomach.
is the cutoff.
100.
When I was growing up and I did my education somewhere in 1990s, so that time it was 120.
It is still 126, but for diabetic. For
Okay.
pre-diabetes is a
It's
gap.
100. Okay.
Now, pre-diabetes is a condition where if you treat it, if you manage it, lifestyle modification is the key. And if you manage it well, you do not get diabetes. But if you don't treat it, if you don't manage it, you don't consult a diabetologist considering, oh, this is normal values, then within 3 to 5 years, you can be a diabetic patient, which is for rest of the life. So when I say diabetes is reversible, I never mean that diabetes can be cured.
Okay.
You will always be a patient of diabetes, but without taking any medicine.
Just changing the lifestyle.
Which is
Okay.
the cause of your diabetes.
All
So
right.
fasting below 100 is normal. Above 126 is clear diabetes. 100 to 126 is pre-diabetes. Post-meal above 200 is diabetes. HbA1c. We say it HbA1c. It is HbA1c. That is glycosylated hemoglobin. That's last 3 months average sugar. It has to be above 6.4.
Okay.
Normal value for a non-diabetic is 5.4.
So if it touches
That's a gap.
6.4, you are a diabetic.
Yes. If it is 6.4 and above, you are a diabetic. If it is 5.4 or below, you are normal person. But in between that is pre-diabetes.
So 5.4 to 6.4 is
5.5 to 6.3 is pre-diabetes. You can stop the progression of diabetes from pre-diabetes to diabetes. You can reverse pre-diabetes. You can reverse diabetes. You can go into remission stage.
That is a very valid point. Now, you said there are two types of diabetes which are very, very common. That is type 2 and the gestational. Right? And you said that these both can be reversible to some extent. Like reversible, you said you are a diabetic, but with the help of lifestyle, you can control it. But in order to come to that normal level, some kind of anti-diabetics must be required.
Yes,
Right.
you cannot straight away jump to reversal. First point is to treat diabetes. Now, if there is someone who is coming to me with, let's say, fasting above 200, post-meal above 350 and HbA1c above 9, I cannot say that I can make you reverse in 3 months. My first goal for this patient is to bring them to normal sugar levels. Start them on basic anti-diabetic medicines, which can be stopped later.
Okay.
Start them on
No, there is a long-term belief that anti-diabetics once started, we cannot stop.
no.
So that is not true.
It's
There are
definitely
drugs which you can stop. Okay.
There are drugs that you can stop, and that's the criteria of diabetes reversal, that your HbA1c has to be below 6.4 for 3 months without any diabetic medication. Only then you are a candidate for diabetic reversal,
All right.
or you have achieved diabetic reversal.
That's a very good point to know, and I think quite a few of us are unaware of it. Another thing that I had noticed is, I mean, I had an endocrinal problem, so I used to visit where diabetologists were there in the panel, and I used to notice that people would come from very far and they would wait for 2 to 3 hours before they can meet their consultant, and then the same thing would have to be repeated after maybe a month or maybe 3 months. So they would, ignore it from distance from far, and 3 mahine fir se 2 ghante baithna. So they would probably avoid it. Now, I have heard, I am a content writer, so I write for websites. So one of the websites I write is a remote monitoring of blood pressure, remote monitoring of diabetes,
Blood sugar.
especially of severe blood sugar fluctuations. So in that, this remote monitoring, I had realized that the remote monitoring is taking care of the client every day.
Yes.
Whether they are giving an injectable with a band or with an online this thing, or an online which is measuring your blood at regular intervals
CGM.
and dispensing the insulin directly into the blood. But all these people were monitored better because they are day to day, and maybe sometimes even hour to hour fluctuations were being monitored by a proper doctor.
True.
So that is not possible with the general pre-diabetics and diabetics here.
It's very much possible.
Possible if they are online. what do you say about your online practice? I know that remote monitoring is going to be made better, but how can you convince our listeners that yes, the online monitoring is much, much better than physical 1 or 2 trips every 3 months or every
True.
6 months?
40 years, 30 years ago, the death of human population was because of acute infection. Cure comes in acute condition. In chronic, lifelong condition, it's always care. For care, you do not have to be in front of me. I can care for you. I can care for your diabetes. Even you are at your home and I'm at my clinic space. In chronic disorders, where regular monitoring is the key component, you have to be in touch with your doctor.
Okay.
So if waiting line is too long, going to the doctor, coming to the doctor, and doctor is spending only 10 minutes with me, I am wasting my whole day taking half a leave. That's not possible every 3 months.
And I think your appointments online are 45 minutes.
My-
That is the amount of time you're giving to your clients. And that too, you do it daily basis for a week. I know that because you're treating my mother.
Yes.
And I can see the difference in her infections within a week. So that daily care is definitely better. And that is what you are offering at your clinic. So even though your clinic is in Motera, but the patient is in Gandhiram or Gandhinagar, the online monitoring is going to work just as well.
Absolutely. If you're craving for a chai, you do not have to go down. You can call someone and bring it up here. The same science will be applied in diabetes.
Okay.
You have to understand that doctor seeing you physically is not going to change your treatment. What is going to change your treatment is you being in touch with your doctor.
And the blood reports.
And
what you have eaten and what you have not
your
eaten.
daily diary, your blood sugar levels, your fluctuations in your blood sugar level, how are you doing physically is what I need to know.
All
So
right.
you need to have a glucometer at home, blood glucose monitoring you can do, self-monitoring. You have a weighing scale at your home. You step on the weighing scale before you call me. I have these 2 modalities that I need to see the change in them. So that's why teleconsultation or online consultations for lifestyle disorder are actually better than physical visits. Because you get to spend more time with the doctor. The doctor,
More quality time.
The doctor is just not sitting in front of you, but on the video camera. You are the only patient that she is dealing with.
I agree.
And I'm not worried, okay, I have 10 patients waiting outside because this patient deserves my care the most.
Okay. Another thing that I would like to say, there's this misconception, I would say, that only fat people have got diabetes. Now, obesity is related to it. Is that true?
Obesity is actually one of the reasons for type 2 diabetes.
Okay.
But there are 2 types of type 2 diabetes. One where there is insulin resistance. So obese people have more insulin resistance. The body is producing more insulin than needed, but not able to utilize it.
Okay.
And the second type of type 2 diabetic patients are thin and lean patient. They also get type 2 diabetes. Their sugar levels are way higher because their body is not sufficiently producing insulin. Not stopping completely like type 1 diabetes where they need to have 4 pricks a day, but just not making enough. So they need insulin
Very
support.
thin people can also be diabetics.
Yes.
And obesity is not always related. Obesity is mostly, but not always the main reason. You don't need to be fat to have diabetes.
No. But if you are fat, if you are obese and you are diabetic, chances of your reversal is much more than a thin and lean person.
Oh.
Absolutely.
So a fat person can have diabetes out of their lives simply by controlling it.
Most commonly. Whereas if the pancreas is not producing sufficient insulin and the patient has to be on insulin for long, their reversal becomes a little trickier.
Okay.
But if you have insulin resistance where your body is actually making more than needed insulin but not utilizing it because your BMI is more, you are obese, simply by losing weight, 15% of your baseline body weight. The
insulin will start working then.
The insulin will stop resisting.
Okay.
The body will utilize it more.
That will bring me to my next very important question. Abroad, everywhere, Australia, America, UK, there is this furor about Ozempic. And Ozempic is supposed to be the next thing for losing weight.
Yes.
And that too, it has got no side effects at all. That is what they say. Basically, that is what it's available in injectable form abroad, not available in India as yet.
It is.
It is injectable form.
Again, the group is GLP-1 analog.
Okay.
GLP-1 is a hormone that our intestine make when we eat food.
Okay.
That's the hormone responsible for our satiety or thinking and giving signal to the brain that, okay,
My stomach is full. Okay.
that hormone is being synthesized in laboratory and given to you in 10 multifolds, injectably, orally. We have oral formulations here. We have biosimilar component here, which works as efficiently.
So basically, they are used as an adjunct to diabetic therapy.
They are used as a diabetic therapy, as an anti-diabetic, anti-obesity therapy.
So it's like you said, if they are less fat, insulin is utilized better.
Yes.
So you're making them less fat at the same time you're using it as an anti-diabetic.
True.
So even the sugar comes down. That's wonderful. So Ozempic, that's why is I think not the over-the-counter drug.
It is
It is not available. It is only prescribed to diabetics. But I think there's a very big shortage of the drug in the world. That is what I've heard.
Because in US and all, it is prescribed as anti-obesity also. Whereas in India, we use it for anti-obesity, but only in diabetic patient.
Okay.
That is why we have the same company, same manufacturing in oral tablet form that you have to take daily. And we have an injectable but different molecule.
But it's available freely as over the counter also.
No, not over the counter, with prescription only.
Acha, so pharmacists cannot sell them without a prescription.
They cannot sell it without the
And
prescription.
if they do, I mean, it is possible in India.
Again, the dosing are very tricky. Like for an oral composition, it starts from 3 milligram, goes all the way up to 50 milligram, which is still currently in making. Right now, we have till 3 and 14.
Yeah, 3, 7 and 14. That's
so
what I heard.
gradually, what happens is it's not something that does not have a side effect. It has few side effects.
For
which
example?
are nausea,
Okay.
vomiting, because you are constantly giving a signal to your brain thinking it is full, you will not get hungry. If you try to eat, you will end up puking. There can be mild diarrhea, mild vomiting, headache, mood swings. These are all side effects, but it subsides within 7 days to 2 weeks.
Okay.
That is why such medicines which can have side effect, which needs regular monitoring, cannot be sold over the counter.
And that is why you come in.
That is where we come in.
So it's being used as virally as it is being used abroad?
I have been using the oral formulation of semaglutide since 2022. The injectable form of liraglutide since 2018 for my patients.
And it's working.
It's working.
Are they losing weight along with losing the sugar?
They're losing weight. That's why they are reducing the sugar.
Okay.
And that's why they're going into remission or reversal phase.
All right. Now, I have heard that a lot of organs are being damaged if you don't look into this. There are many people who don't want to believe they have diabetes. And there is a genetic uphold to it. So if there is, for example, your father has it, you will have it. Is that true?
No.
No, so it's got nothing to do with genetics.
No.
Okay.
It has to do with genetics. Genetics makes you more prone to get diabetes.
But not necessarily get
Not
it.
100%, because your lifestyle, your physical activity, your sitting on the chair for 12 hours job, your bad habits like smoking, alcohol, tobacco, in Gujarat
is
we
what
have
is
masala, tambaku. These all things also make a huge part of a lifestyle disorder.
It has been a very enlightening conversation with you, and I'm sure a lot of our listeners will benefit from all the small little tips and bits of information that you've given us. Before I sign off, I would like to know whether you have any message for all those people who are reluctant to visit a diabetologist, but would really benefit, whether they are in the pre-diabetic or diabetic stage. So if you have a little message for our audience, please do share with us.
Diabetes does not go anywhere. It is going to follow you. It is going to complicate you. It is going to cause damage to your body from head to toe.
Okay.
So visit a diabetologist personally. teleconsultation, opt for teleconsultation with me, but make sure to control your diabetes before it causes any damage.
Like maybe blindness or maybe even kidney failure.
It can cause from brain stroke to blindness to cancers, heart disease, liver dysfunction. It can cause kidney problems. It can cause peripheral vascular disease. It is the leading
The list
cause
is endless.
it can cause amputation.
The reason that you are actually in this
And
field.
I became a diabetologist.
Yes. Thank you very much, Nimmi, for being with us today and helping us in this journey and understanding diabetes as such, which is a very major, I think, disease for now.
And for next few generations.
Next few generations. So thank you very much again. And that's all from us at VCube. Signing off now, Dr. Shachi from VCube Podcasts.